You brothers and sisters, this is Dr. Kenny Yong speaking here as I have survived COVID virus infection category 1. Started from the 1st of July to 3rd, actually feeling not good. On the 3rd, PCR is positive. And then it took me 18 days to zero conversion completely. On the 21st, my PCR is negative. And my antibody, neutralizing antibody, is the RBD antibody, the spike 1 protein, miraculously on the 21st is 48, and then the minimum is 3.3, so it's 16 times above my defense mechanism. The minimum level of protection of antibody level of the spike 1 protein is actually 3.3. After my natural infection, it went up to 48. And then I have another president of another society, it went up to 58. So natural infection is no joke. It's a wonderful way to improve your level of your antibody. Not just that, I have developed also holistically antibody against the nucleocapsid. Nucleocapsid is the protein N. The nucleocapsid or protein N is IgG, IgA, and IgM. So IgM is the innate one. IgM is the innate one. IgG is the long-term one, and then IgA is present in the mucosa and the GI tract. So IgA, IgM, IgG, I have a very high level of 225. You see, so the minimum protection level is 150 of these N protein, or at least 125. So what I want to tell is that my experience in the COVID-19, because day 1 to day 6, I was doing ozone, I was doing vitamin C, I was taking high dose IV vitamin, IV, a lot of vitamins I'm taking very high dose, and then I was doing Ivermectin as well, and then I switched brand later, it works very well. Then what happened is that I am also doing ultraviolet blood irradiation and ozone step 1 and step 2, the major autohemotherapy. So the first 5 days, me and my mom actually was doing well on the 3rd, 4th, 5th, 6th, 7th. And then we implanted water and jelly stem cell, 100 million cells inside there. But both of us, me and my mom, took an acute turn on the day 7, not feeling well. Day 8, we crashed. So we belong to this special group called the day 8 deterioration group, which we need completely to go to hospital, and steroid is a very important item into suppression of this very rapidly deteriorating case day 8. Some people crash at day 6 and then they don't do well and they can die within 3 days to 5 days, 7 days to 9 days. So as I was crashing, my brother, there's a lot of doctors who call me up, the brother Kesingan, then this Alex Wong, as well as Peter Chan and Dr. Edwin, and this Andrea was talking to me on the phone and say, you know what, you have been a few days already, something is wrong, you have to go to hospital. So at the end, brother Edwin and Alex was the one that sent my mom to the Sungai Buloh hospital. No choice, it was a wrong hospital in the Sungai Buloh anyway. So no choice, because there's no bed and all this. So Peter and Alex are arranging the hospital's admission to this Sungai Buloh. Then to secure a bed for my mom, which is at the end bad. My mom admitted to Sungai Buloh Hospital on the 9th, and the 9, 10, 11 was doing okay, quite well with some steroid there, but it's a wrong steroid. It should be a methylprednisolone right from the day 1. If you understand the MATH protocol from the FLCCC website. There's this website called the FLCCC. It's a wonderful website. You have to listen to Dr. Pierre Correa to be able to understand the full protocol, how to control the cytokine storm, to prevent the SARS, the severe acute respiratory distress syndrome, and then to get rid of the this lung compromisation, and as well as the viral debris phase. So when a person get COVID infection, the first thing is a viral phase. The viral phase is very short. You get some nose block, you get some flu, and then the virus phase is about a few days, that's all, and some fever. Once you have a very effective fever for a few 1 or 2 sessions, 1 hour, more than 39.5 degrees Celsius, I believe the virus phase is gone. You are officially into a viral debris phase. It is a viral debris phase that all the virus die. When the virus die already, then the S protein, the spike protein, you see, will be released into the body in debris, and then the N protein will be released, and the rest of the whole virus is dead. The whole virus are pecah already, then all the other antigen go into your body, and your body is a shower with this meteor rain shower of these kind of viral debris. So I posted a photo about how the virus look like. If you look at this coronavirus, what happened is that you can see that there is a spike protein, outside there's a membrane, then inside there's a nucleocapsid, and then there's this envelope there. You saw, no? The outside is envelope, and then there's this spike protein. The outside is envelope, spike protein, S1 they call it, and the membrane. After the membrane, then there is this nucleocapsid. Nucleocapsid is N, and then the RNA genome. Okay, so the RNA genome is nothing much, but the one that is really causing problem is the S1 protein, the spike protein, and the N protein. These two will be like a meteor shower after the virus phase is gone, and then progressing into viral debris. Then the pulmonary phase begin. Because of this, cytokine storm is caused by the antigenic reaction, which is necessary, because when a person want to overcome, they want to become. So you want to let control meteor shower, but because of the severe cytokine storm, and then there is a rapid damages, free radicals, rapid generation of free radicals, and then these free radicals is the one that do the lung damage, and then the lung will go undergoing a procedure called the organizing pneumonia. It looks like real pneumonia, but actually totally is a fake one. It's not a pneumonia, so all kinds of antibiotic wouldn't work. But if you go into the hospital for a few days, then you might want to use it because nosocomial infection. But actually, so it's not a real infection, okay? But some antibiotic won't kill you, okay? To prevent a secondary or nosocomial infection, okay? So, but the important thing is that it's a fake pneumonia, and then the pneumonia doesn't look like a real pneumonia. It's called organizing pneumonia. There is a paper published by Dr. Pierre Correa in very detail talking about this organizing pneumonia. And only a very experienced radiologist is able to find out and see this on the X-ray film. And then this organizing pneumonia can go into diffuse alveolar damage, the DAD, or they can go into another condition called acute fibrous organizing pneumonia. They call it the acute AFOP. Oh wow, this is the one that makes your lung looks white color in the X-ray. So this is the reason why you want to really very fast send the patient to hospital, and then steroid is a must. You have to follow the MATH, methylprednisolone, up to 250 milligram per day, even up to 4 times a day is 1 gram a day. Dr. Pierre Correa has done that with a very astonishing CT scan improvement result. You see, I can show you this CT scan, day 7 and day 10. Day 7, the CT scan lung was white color, and then after 3 days of 1 gram of methylprednisolone IV, even the whole lung become very well clear, 70% clear up. So it's wonderful medicine called the M. The A is IV vitamin C. You want antioxidant dosage, which is about 2 grams per hour. And then after the patients get much better, 5 days later, you can drop down. 7 days later, you can drop down to about 500 milligram per hour. So if you can do 24 hours if you are doing an infusion pump. So it's 2 grams per hour is an antioxidant level, okay? It's never a pro-oxidant level, okay? During the cytokine storm in ICU or in a hospital, everybody need to know this is not a high dose thing. If you want to do the high dose thing, it should be in the viral phase, in the early beginning, like myself. So me and my mom, day 1 to day 7, we were doing antiviral. Then after that, day 7, we crashed. We were dealing with the viral debris. We didn't know what to do. But the viral debris comes down with the cytokine storm. You need hospital, you need MATH. A is ascorbic acid IV, and then MA, methylprednisolone. A is ascorbic acid. T is thiamine. Thiamine is B1. You can take orally a lot of B complex capsule. But the important thing is that you need to get thiamine injection. Is very cheap. IV injection is very cheap. You can even inject 5 to 10 cc or even 3 to 6 cc into the vitamin C drip togetherly, the thiamine. So this is a world very famous HAT protocol, hydrocortisone, ascorbic acid, and thiamine. But now, because of severe, very advanced sepsis fast problem, you can convert it into a MATH protocol. The T is thiamine and the H is heparin. Because a patient, when going through cytokine storm, they can get hypercoagulability. The blood can clot everywhere, sort of like a pre-DIVC thing. It's a coagulopathy. It is not a DIVC. You will not see DIVC, the consumptive coagulopathy. So this coagulopathy is because of too much of cytokine storms. The cytokine protein is too much. The blood becomes so thick that they become hypercoagulable. A person can get a stroke everywhere, and then get a heart attack and stroke, and then every organ clog up just like that. So you can have a hyperclotting situation. So you want to start your low molecular heparin injection like Klaxane. I was receiving Klaxane injection in the fats for 15 days. So what happened is that this is a correct protocol to follow, and then oral aspirin if you want to, if you are not available with the Claxane. Oral aspirin is important. If not, you use Zauletro. Zauletro is a brand, or you can use Plavix once a day, no problem. And then because when you use this capsule and all this tablet, you don't need to do the INR and the PTT kind of monitoring. Don't do warfarin. And then if intensive care in the hospital, you can do IV heparin as well. The IV heparin is just the one that will prevent the stroke, the protocol, the loading dose plus the infusion pump. It's an easy thing in the intensive care. Okay, so this is the MATH, and then the ivermectin. I want to talk about the ivermectin. Dr. Pierre Corey was talking about 0.6 milligram per kilo per day. Okay, or higher. And then his message during the Ivermectin Day in Malaysia and Ivermectin Day recently in the Indonesia, Dr. Pierre Corey was talking about no longer talking about any other 0.2, 0.4. They are talking about 0.6 milligram per kilo. And the real message is the sicker the patient is, the higher the dosage actually. And if you really study Dr. Paul Marik slide, and then the education, you would be able to understand that Dr. Paul Marik was talking about the safety dose of ivermectin is even up to 2 milligram per kilo per day. So if you are 90 kilo, or let's say you are 80 kilo guy, 2 milligram per 80 kilo is about 160 milligram per day. You understand or not? So that gives you about 15 tablets, okay? 15 tablets of 12 milligram. You can take 3 tablets in the morning. You can take 5 tablets in the morning, 5 tablets in the evening, and then 5 tablets in the afternoon, and then the evening. So 5 is 15 tablets. 12 milligram is wonderful. That you would be able to have this 2 milligram per kilo. That's even okay. That's a safety dose, okay? This is a parasite, anti-parasite medication that you maximally get some diarrhea. So what happened is that my mom admitted to 9 of July in Sungai Buloh Hospital. First 3 days doing well. The last 5 days was having a SpO2 happy hypoxia at about 52. You know, my mom was having a right to left shunt because of the lung being having a keloid. There's a keloid, rapid keloid formation in the alveolar space. That is what we call the AFOP, the acute fibrinous organizing pneumonia that's happening to my mom. And then the X-ray looks white, and then everybody panicked, and then they were withdrawing medicine and not, they were depriving my mom for ventilator. And then my mom was yelling for ventilator for 5 days, the last 5 days from the 12, 13, 14, 15, 16, and my mom passed 16 in the morning. So because of the whole Sungai Buloh Hospital, they have some ventilator they don't want to give because they say my mom is old age and my mom deserve this, not deserving this ventilator. If my mom is intubated, ventilated, it will lead to a national burden figure that it is a burden because she will become dependent on that ventilator and she's going to die anyway. I say, why? I talk to the head of department. I say, why don't let her die trying? They were just depriving her chance of surviving. So I'm very mad and also angry, and also I don't want to live right now because I'm alive. I went to Sungai Long Hospital. I was doing well, and then after that, I crashed also because they were giving me dexamethasone, 8 milligram for the first 4 days, which is wrong. I think I cannot, we cannot just go into dexamethasone because if you have methylprednisolone, the patient is category 4. You have to start with methylprednisolone, the correct PA protocol. You have to go into 250 milligram IV per day, or you can do BD, TDS, or QID. You can be up to 1 gram of methylprednisolone, the solute medro, in the IVs, in the intensive care, and also in the hospital with Cat 4 and 5 patients. It saves life. You see, this is the time where we are the doctor. We cannot use our chronic ailment, stupid mentality in the past and say that, I have handled some chronic diseases, so now I automatically is a COVID doctor. I think it will pretty much work in a new COVID situation. In this new COVID era, everybody have one product trying to sell. Everybody is trying to sell product in this market, and then everybody seems to be a COVID positive, a COVID doctor, which is a very little stupid automatic upgrade of your chronic ailment certification of any training. Bullshit. You cannot be a salesman and do training and tell people that your product works. No, in COVID, it is an ICU medicine trying to be converted into a pill form and then delivered to the house, and then use telemedicine to deliver this intensive care medicine in the community. So we have to be very serious as a doctor just to renew and learn from this adaptive virus every day and learn new things from this virus. We cannot just be quiet and then stay there, and then you need to join a lot of group, okay, a lot of Mafim group, a lot of COVID group, a lot of Shankara Shetty group. Please call Paramjit so that you can able to connect to this Shankara Shetty group that I'm actively educating people there. So you need to understand to stay close with a COVID frontline doctor in Malaysia that is having result rather than you struggling there, okay? So myself, I'm Dr. Kenny Yong here. I admitted to Sungai Long Hospital very painfully from the 10, which is my 9 days of crash. There's this very special group of people who crash. It's 19 days. It's very bad. So these 19 days, the day 9, day 8 deterioration belongs to a special group that you need to combine intensive MATH protocol plus Shankara Shetty protocol. For those of you who have not heard of Shankara Shetty protocol, shame on you. You are in such an epicenter right now. Every day, 20,000 COVID doctors, that COVID patient that is already detected. And then it is so bad that I think this lockdown is going to be permanent. And then we have some Royal Circus Crown there. This Noisham people there, the DG there is going to dance and tell people that this is a pandemic of the unvaxxed people. You know, this has been a pandemic of the people not vaxxed, which is very stupid, because everyone who do vaccination, please, you need to do your blood level test, okay? If you do first dose, okay, any brand, okay, do you know that if you do 1 dose of vaccine, 14 days, if you don't die, 14 days to 28 days, please do a blood test to see your antibody level. Do you have a spike protein S1? It's called anti-S1 RBD test. This one, Genesis Lab also, Griebers also, Clinic Path also, many major lab already doing. Doctor price about $50 or $40 or even $60, cheap. Okay, then if you do another type of vaccine, that is this anti-nuclear capsid antibody. Okay, this is the N protein antibody, which is the IgA, IgG, IgM. Don't you know that if you do vaccine 1 dose for 2 weeks, if you don't die, 4 weeks, 2 to 4 weeks, if you don't die within the 30 days of the first or second dose of the vaccine, you should be able to do this antibody level just to be able to check your body response whether you have the real protection or not. Why is that so? Because right now in your whole country, 20,000 people who is positive with COVID. You know what happened? You go and check in the hospital now. Okay, you think this is a pandemic of the unvaxxed? It's quite an idiot if you think like that, okay? Please don't think that this is a pandemic of the unvaxxed. Why? Because now in the hospital, more than 80% of the patient that is admitted to the hospital with COVID positive, 80% of them is vaxxed already with first dose or second dose. Or after a while, they do first dose and second dose, they have zero protection. But they become infected because of, number one, over-lancyism. They become so lancy, they think they are protected. Number two is over-arrogance. Okay, they are over-arrogance that, oh, I have injected 1 dose or 2 doses, I am protected already, which is bullshit. Okay, how would you know you are protected without you ordering the test, okay? And then the third one is because of overconfidence. You think you are contacted already, you are vaxxed already, you go outside and walk around and this and that, which my mom go for a vax in Sinovac. And the Sinovac is a hit-kill virus, and I think it came alive, resurrected, you see. So you end up getting a live vaccine. Actually, 2 weeks, my mom, after the first dose of a Sinovac, get infected. And my whole family got infected. I was following all the protocols, staying at home for 9 weeks. I didn't go anywhere. So we didn't do wrong. My whole family didn't do wrong. But one person go and do vax, and after that, within 2 weeks, get the live vaccine. The vaccine came alive, you see. If it's a half-boiled egg, it's not a full cook. It's a half-boiled egg, and then the virus come alive and then infected us. Then you can ask the president of MPCN. They have been doing a lot of tests on Sinovac. Okay, most of the Sinovac, 1 dose or 2 doses, pathetically the antibody level is single digit only. So this is not to say vaccine failure. Everyone react to vaccine differently. But you need to understand, if you get vax already, please go and order these tests, okay? You order the combo test, is the best by Griebers or Genesis Lab. You ask for CQA, it's called this a COVID quality analysis. You will get the N protein and the S protein. So when you ask your lab, you ask them, I want to test the S protein, the RBD protein, S protein, spike protein antibody, also together with the N protein as a combo test. You understand? So you order these tests and then you know your antibody level. Surprisingly, most of the mRNA one will be protecting less than 50, which is not good because far from getting protection, okay? We want a protection of more than 150 or at least 125. Myself, after 18 days in hospital, I went through the cytokine storm. I stopped breathing for 4 times. And I have been near that experience. I remember I stopped breathing for 4 times, and the nurses and the rest of the people were looking for crash car. They were calling for doctors here and there, and I almost died on the 15th. And the 15th whole day, I was struggling with coughing and choking, and it's a biphasic, very excruciating pain. Breathing in is painful, coughing out is very painful. This is a very unfair breathing that I have to go through. And then I got so serious, then they got serious. They convert me to methylprednisolone 180 milligrams for 4 days. The first day I feel nothing, and then the second day start improvement. The third day very well. The fourth day already I'm very, very excited already. So I am actually officially not much healed by the dexamethasone, but the methylprednisolone. And I smuggle in all the Shankara Shetty protocol products, and also the MATH, vitamin C, and also magnesium, zinc, and as well as bicarb into the hospital, and I got the drip myself. So I'm a direct beneficiary of the MATH protocol directly from the Pierre Corre. Pierre Corre is in the FLCCC, and this doctor is speaking every day in that website. All the doctors should go to FLCCC, get fully educated to get the mentor-driven protocol, not the salesman-driven protocol, okay? You don't try to be a salesman and sell things and then tell people you're a COVID doctor, because COVID is a severe acute respiratory distress syndrome. The SARS is not a typical one. And then the ARDS that you see in the x-ray, the ARDS, acute respiratory distress syndrome, is of a fake one. This is a dry type, not the wet type, okay? And then the pneumonia is a fake one. It's called organizing pneumonia. If you want this study, I can post to you. You can actually private message me for this study. I can send the PDF to you. And then if you want to get educated, I'm available in Shankara Shetty protocol group. You ask Dr. Paramjit or Dr. Vijay about this group, and you can be added to the group. I will be educating people there every day. And if you are welcoming me into your group, I will be able to join your group to be able to share my life experience right now. I believe I'm the one that is chosen by God to go through this as a doctor and come back and explain everything in very detailed, very good medical terms, and so that I can make all the doctors understand what I'm talking about, to make it clear to you so that you can also help the next thousands of patients yet to come. Okay, so COVID is such a big thing that it can happen to you. And my mom at the end, when my mom went into the hospital, guess what? This is a very cruel thing, and the whole hospital is not allowing any family member to come close, which is very funny, because when they can gown up in PPE and go in and become so sterile and so close to my mom, why as a family member my mom cannot die within my arms? With my family arms, my family member, why can't they just wear the PPE and stay at a distance and then watch my mom and talk to my mom? If my mother is able to get close to the family member, this is absolutely wrong practice in the whole Malaysia. The whole fucking Malaysia is wrongly practicing this kind of medicine, and the patient need to die alone, and then all we need to see them is by WhatsApp. Since when dying medicine is already a telemedicine that you can talk to your old people dying away through the phone only? And then the next moment, when my mother died on the 16th, okay, in the morning, they still think the body is so infective. And then they say this body must be able to be cremated and this and that. And I have to wait for the body for 4 days. In 21st afternoon, 4 o'clock, only I received my mom in the box of ash. Okay. So to whoever listening to this message, please don't think that COVID-19 is not your fault or your cup of tea, because it can happen to you, you see. The next moment, your wife will be receiving you in a box of ash, okay? Okay, it's Dr. So-and-so in a box, okay? Because you're sick, okay? No matter how smart you are, you try to talk when you're intubated and ventilated, okay? I know you're a smart ass. You are a doctor trying to train many people, a trainer here and there. Oh, you are a product seller. You have this fantastic product for this COVID-19 now. You have one very exciting product that you're going to sell everything, or this, that. I know. But try to sell anything to your own family when you are intubated and ventilated yourself in that hospital, when you have day-8 crash, and then now this is such an acute situation that you really need to unlearn, de-learn, relearn, and also put down your ego. Don't try to use your chronic ailment expertise to treat this acute disease. This is a very bad mistake that you will regret for the rest of your life. If sometimes your child is the one that would receive yourself and your wife, your husband and wife, in a box in an ash and then comes to the children, okay? And then the children don't know what to say. All the expertise is gone, and then you're a legendary hero, you're gone. So you can be intubated and ventilated and die in 3 days, just like our very well Dr. Jacob. So it's a very painful situation. So what happened to me is that after I was dying on the 15th, and then the next day I woke up on the 16th, I got the news that my mom died in Sungai Buloh Hospital, this stupid hospital with the head of department rubbish. So I was making a lot of phone calls to try to save my mom. I talked to the head of department and nothing is available. I asked them to give vitamin C. They say don't have. I say I have. Can I bring in and give to the patient? They say cannot. And then I asked them for Ivermectin, continuous treatment. Then they say they don't have Ivermectin. I tell them I have this. Can I give to my mom? And then they say, no, we cannot do that in this hospital. And this is a rubbish hospital, really. Don't go to Sungai Buloh Hospital. The head of department is some stupid Suresh, you see, and a stupid infectious disease control specialist or whatever shit. 21 years already and failed to get updated, and then he is not keen to even learn new things, and he said he has been settling 1 year, past 1 year, and then without good result. For God's sake, for heaven's sake, this stupid asshole Dr. Suresh or whatever head of department in Sungai Buloh, I don't care whether you know him or not, this is the guy that we should really use a baseball bat to bat his head, and then get him to rethink again. The country need a lung specialist and a top ICU specialist to handle the cytokine storm. We don't need idiot like these infectious disease specialists who even miss a very simple very simple anti-parasite is ivermectin. So this country is run by top clowns, okay? And I'm talking to you right now. Your country is run by a lot of circus people with a top class of world clowns right now. That you need to stand up, okay? All of you doctors stand up. If you vax already, please do the blood test. Don't be stupid, okay? If the blood test is not covering, you have to be brave enough to Instagram it and voice out that you do not have a good coverage, okay? And then complain to the right lawyer group. Because we want the lawyer to collect all these 1,000, 3,000, 5,000 patients' data with very bad. After 2 doses of a vaccine, there's no protection. And then you talk about booster. Okay, go and inject 10 doses. After 10 doses, there's no protection. Come on. You know who to sue or not. And then you change brand, okay? You end up don't know who to sue, okay? Please don't blindly do vaccination. If you want to do vaccination, that's great. I challenge you right now because my own N protein is 225. Any one of you vax already, please do your blood test and come and compare with me. I'm the natural active infection survivor. Okay, my S protein, spike 1 protein is 48. Okay, any one of you dare to challenge, please do your blood test and come and see me. Okay. So right now, I am a survivor from the natural infection with very strong antibody, neutralizing antibody towards the N protein, the N nuclear capsid, and also towards the anti-S1 antibody. Okay, right now, okay. So the S1, this one, anti-S1 antibody, RBD antibody, anti-S1 RBD antibody is receptor binding the domain. Anti-S1 spike protein 1. Okay, I have all the neutralizing antibody that you want to know. So any one of you vaxxer out there, you have vaxxed already, you please don't join the pandemic of the vax. Because you please don't go and jam your hospital. Because now the whole country hospital is so full. Is because it is full of all those very stupid, over arrogant, and then overconfident vax patients. More than half and more than 80% of a lot of private hospital patients, COVID positive right now in hospital, they are the vax patient. You understand or not? This is the pandemic of the vax patient is because overconfidence and over arrogance, and they've forgotten to do the antibody level blood test. So if you order this CQA from this lab, it is a doctor price is 90 only. Your group order, I think maybe 70, 75 bucks only. You can sell to your customer maybe 120, 180, 160. I think it's okay. You know, it's okay for the for collecting data, and then in the same time your clinic makes some money to pay some bills and sustain some clinic. Okay. So this is Dr. Kenny Yong here. You can contact me 012-646-8088, okay? Or you can send email to me wadc.new3@gmail.com, wadc.new3@gmail.com. You can get contact to me, and then I can be able to help you to understand some information. And if you want to refer patient and manage patient together, my name is Dr. Kenny Yong Jensen here, and my handphone number is 012-646-8088, 012-646-8088, and you can get to me through Dr. Paramjit and Dr. Vijay, and you can join the Shankara Chetty protocol group discussion. Okay, you can see me there and you can introduce yourself.